guys, I'm Akshata from Paper Crane Society. I wanted to make a video detailing a few things that I believe are very important to know about the current COVID scenario, or to know in this current COVID scenario. I'll be flashing on the screen right now the timings of the different topics that I'm talking about. You guys can always scrub through the video and go to whichever topic you guys want to listen to. So the first thing that I'll be talking about is my personal COVID experience. Things that you should do in this pandemic, in the second wave. Important things to know and to understand. Where to donate. Information about proning and the vaccine differences. Okay. So first of all, I got COVID a couple of weeks ago. When I first got COVID, I had a sore throat, so that's what I thought was my main issue. I thought that I had the common cold or a viral fever. Eventually, my fever got really bad. It got to 104. I wasn't able to sleep. I wasn't able to get out of bed really. And the fever would not go down with any paracetamols. Eventually, we decided to get tested because I live in a very small family. It's just my mom and my dad, and they started also showing symptoms and getting fever. So we just decided to get tested to be on the safe side, and it ended up turning up positive. So immediately we got a prescription, started the medicines. After starting the medicines, there was a drastic improvement in my personal condition. My fever was gone quickly. After my fever was gone, I had fatigue for maybe a week or so, but this can change from person to person and it can range from person to person. I also lost my sense of taste and smell around that time, but this lasted for me for a maximum again of a week. My mom and we recovered pretty alright. We recovered pretty quickly, but my dad, his condition got worse. He had to get hospitalized and he had to end up on an oxygen concentrator. Seeing that was quite scary for me personally, because my dad is quite a happy, jovial man, and now I was seeing him hooked up to this device, and it's it scared me. Well, the simple way to say it is. So if anyone was thinking that अगर COVID होना है तो होगा, or it it can't hurt me anymore, or I wasn't sick in the first wave, I won't get sick in the second, do not think that. Do not think that, because the second wave is proven to be deadlier than the first wave, and there are ways to prevent it. So agar hoga to ho jayega, it's please don't keep that mentality. You are only going to be harming yourself, your family members, and others. Being on both sides, having COVID myself and seeing family members who have suffered through COVID, I can tell you, if you are telling me that you don't know anyone who has gotten COVID or who has been affected by COVID, you are lying. You are most definitely lying. So, as a result, that sort of inspired me to make this video for information for anyone who currently is going through COVID or has a family member going through COVID, and would like to show that information. So I'm hoping this can help someone. So, things to do in this current pandemic. Number one, please stay at home. Stay at home no matter what. I understand that we've been going through this pandemic for a long time now, and people are starting to get frustrated, or have been getting frustrated, and now are having this cavalier attitude about this pandemic. Please don't do that and stay home. That is the best way that we can help out everybody in the community to stop the spread. We can help to That's the best way we can help to stop the spread. and to take pressure off of frontline workers and hospital workers who are currently working overtime and stressed out and going through terrible situations due to such an increase and such a spike in the number of cases. Um, Number two is to make others aware. Here are some of the ways that we have decided to raise awareness about staying home and to remind others and to hold others accountable to stay home. If you see anyone within your own social circle hanging outside, remind them to follow the guidelines, follow the social distancing, to follow the quarantine, to use the proper equipment and to use the proper masks and to use them correctly instead of hanging them on the neck, to cover the face, the nose, and to make sure there are no gaps near the bridge of the nose or the chin. Number three is to not panic and to not overcrowd hospitals at the moment. Hospitals are already very big hotspots for infection. Overcrowding hospitals and visiting hospitals at the moment puts stress on the frontline workers, I believe. Understand it is a hopeless situation. If you have someone in the hospital, it is quite tempting to want to go visit them and to comfort them. However, visiting them at the moment could make the situation worse. So please do stay home and don't panic. Try to stay as calm as possible and take care of your own health, both mental and physical. Some of the ways that you can remain healthy, both mentally and physically, and staying calm will be put on the screen right now. Number four, take the vaccine when your time comes. The vaccine has been proven extremely effective and it is working quite well. So please do take the vaccine when your time does come. And please do not delay taking the vaccine. I will be giving more information and a comparison between the two vaccines in India, that is Covaxin and Covishield, further along in this video. 5, last but not least, in fact, the most important also, is to sanitize everything. Sanitize every single spot that comes in and out of your house. We might wash our hands and believe that we're safe now, but there are certain etiquettes such as touching your mask repeatedly with dirty hands or not cleaning phones that can often cause passing of germs, or staying in clothing that has been contaminated, so on and so forth. Please make sure and make an effort to clean every inch of anything that has come from outside. So the next thing I want to talk about is important equipment and things that people should know. So in this list, two of the most important things currently that I can think of is an oximeter. So this is a simple home oximeter. As you can see, it's quite small, it's quite compact. If you see in here, there's a red light right there. That red light is where your finger should go and it measures oxygen, it measures your blood oxygen levels. Your blood oxygen levels should never be lower than 95%. Kindly do monitor oxygen levels every 6 hours or so if you have one of these at home. If not, please do invest in one of these. The next thing to have at home, since the second wave of the pandemic is more deadly and spreads easier, it is very important to have the proper masks. What is recommended is an N95, looks like so. It has the metal strap for going over the nose bridge. One that doesn't have any valve on it. If you don't have an N95 at home, then the next best thing you can use is a 3-ply mask with another mask layered on top of it. Another thing to note is if you've gone through COVID prior to this, and the symptoms will, for mild cases, usually last up to a week. However, this can change from person to person depending on the severity of the case. In my experience, certain symptoms for me lasted longer than a week, such as fatigue. whereas other symptoms for me, such as the loss of smell and taste, only lasted up to 4 days for me. Um, and another note, if you've gone through COVID, no matter how great you're feeling now, please do quarantine for the full 14 weeks or until you're able to get a negative RT-PCR test. Certain things for prevention, of course, hand washing with the correct technique that will be shown on screen right here. Another thing that has been considered quite beneficial in mild COVID cases is breathing exercises. There are a lot of supported sources that have a ton of good equipmentless breathing exercises that you can follow. I'll be showing some sources right here. This is where to donate. So in this COVID scenario, it's very important that we support each other and that we as a community come together. Not literally though. Don't come together in a mass. Please stay home. Um, so you can support the community in different ways. You can find someone within your locality who might be struggling and help them out with their groceries or give them food, etc., so on and so forth. Um, or you can donate to a certain organization. A few good organizations that you can donate to who are currently helping in this COVID struggle are Oxfam India, Give India, Hemkund Foundation, Akshaya Patra, UNICEF India. If finding where to donate and finding out the procedure to donate seems overwhelming to you, you can always reach out to us with more questions and we can definitely help you out. Next thing I want to talk about is proning. For any proning cynics out there, this is something that has been recommended by the Ministry of Health and Family Welfare. And a quotation from Dr. Harish Chafle, who is a consultant in pulmonology and critical care in Global Hospitals, Mumbai. He says that in the supine position, which is lying on the back, the major part of both lungs is occupied by the lower lobes. In the prone position, the part goes to the upper side where air in its nature goes up always. So when we sleep in the prone position, the majority of the lungs get properly aerated, which doesn't happen if we sleep in the supine position, which is as mentioned on the back. So some proper ways to prone basically will be appearing on the screen right now. You guys can take a screenshot, of course. These are some illustrations from the Ministry of Health and Family Welfare. It's been recommended to hold each position for 30 minutes to 2 hours. And lastly, I'll be addressing the differences in the vaccines. So the two vaccines that I'll be talking about is one is Covaxin and the next is Covishield. So right here on the screen, I'll just create a table. So the first thing is the origin. Covaxin was made by Bharat Biotech in collaboration with the Indian Council of Medical Research and the National Institute of Virology. Covishield was made by AstraZeneca and Oxford University, and it is produced in India by Serum Institute. Both vaccines have 2 doses at a certain amount of time apart, that can be 28 days to 45 days. Covaxin's efficacy is 81.6%, and Covishield's efficacy has been seen to range from 70 to 90%. So the way both vaccines work is also different. Covaxin works by using the inactivated virus. It is something that they call whole virion inactivated virocell derived technology. Basically, the way that works, I'll just be cutting to a screen explaining that, is they use a piece of inactivated virus to trigger the immune response. Covishield, on the other hand, it uses a viral vector. So, cutting back now, the way a viral vector works is they use another produced virus to act as a carrier. So in this scenario, they'll be using a chimpanzee adenovirus, which is a cold virus. That virus has been altered to not to be completely harmless. Basically, when that virus, the harmless virus, enters your body, it produces a small spike protein of COVID. This spike protein does not give you COVID, it simply fires up your immune response. The side effects from both of these vaccines are relatively similar. Those can entail the reaction at injection sites, such as pain, swelling, redness, itching, stiffness in the upper arm, tenderness, and you can even have headache, mild fever, discomfort, nausea. These side effects are temporary and should subside between 2 to 3 days. If they don't, then please seek out a doctor. These are very common side effects. So that's about it for this video. I hope this helped you. And if you guys have any further information that is relevant, please do leave it in the comments down below. And thank you guys.